All right, let's talk about something that so many of us deal with. That really annoying, nagging pain right on the outside of your elbow. You know the one. It can affect anyone, whether you're a hardcore athlete, work at a desk all day, or just love spending time in the garden. Today, we're going to get right into what's really going on and how you can actually start to overcome it. I mean, if you've ever felt that sharp little twinge when you just pick up a coffee cup, or grip a tool, or even just type on your keyboard, you know exactly how frustrating this can be. It can completely sideline you from your hobbies and make even the simplest daily tasks a real chore. Okay, first things first, let's just get this out of the way. Tennis elbow is a terrible name. Seriously, because for most people, it has nothing to do with tennis. It's an overuse injury. That's it, plain and simple. It could be from clicking a mouse for hours, going all out on spring cleaning one weekend, painting a room. I even heard of one person who got it from prepping a ton of strawberries for jam. See? It's all about just doing a little too much, a little too soon, more than that tendon was ready for. Okay, so let's really dive into this, because this is huge. One of the biggest reasons people just don't get better is that they are fundamentally treating the wrong problem. What most people think is happening with this injury is often completely off base, and, well, that leads to doing all the wrong things. So this, right here, is probably the single most important thing to understand. For years, everyone called this tendinitis. And you know, that itis at the end of a word? It means inflammation. So the whole treatment plan was about fighting inflammation. But here's the kicker. Modern science shows there's actually very little, if any, real inflammation going on. The real issue is something called tendinosis. Osis means degeneration or a breakdown. And once you grasp that, well, it completely flips the script on how you should be trying to fix it. It changes everything. This is such a great way to picture it. Seriously, think about a bundle of uncooked spaghetti. When all those strands are lined up perfectly side by side, it's incredibly strong and tough. That is a healthy tendon. The whole injury process we're talking about is what happens when that perfect, strong structure starts to get messy, disorganized, and weak. Right, so to treat this the right way, you really need to have a good idea of what stage you're in. Now, these aren't always perfectly separate stages, but knowing if you're early in the game or if this has been going on for a while is absolutely crucial. So let's break down that first one. So stage 1 is the reactive stage. This happens right after you've overdone it. The main thing to get here is that even though the pain can be really intense, your tendon's core structure, that bundle of spaghetti, is still totally intact. It's just really angry and sensitive. This is actually the best case scenario because it's the easiest stage to recover from if you handle it correctly. And here is that critical piece of advice. If your tendon is already screaming because it's overworked and irritated, the absolute last thing it needs is more work. That instinct to push through the pain with a bunch of exercises right now, it's just going to make it angrier and drag out your recovery for way longer. The number one priority is to just let things calm down. Now, if that irritation keeps going for months and months, you can drift into these later stages, disrepair and degenerative. This is where that nice, neat bundle of strings starts to look all jumbled and disorganized. It's lost some of its strength. But don't panic. This is still very treatable. The approach just has to shift from calming it down to actively rebuilding its structure. Okay, so let's say you're in that acute phase. Your elbow is angry, it's painful. What do you do right now in the first few days? Let's walk through the immediate game plan. First, and this is key, modify. Don't just stop everything. Complete rest is a mistake. It just makes your muscles weaker. So find ways to do things that don't cause pain. Second, just be mindful of that repetitive gripping. And third, ice can be a great friend for short-term pain relief. Just 10 minutes at a time can really help take the edge off that sharp, acute pain. Look, calming the tendon down, that's just step 1. The real long-term solution isn't about rest or popping pills. It's about actively rebuilding a stronger, more bulletproof tendon. This is where the magic really happens. And the single most effective treatment we have for this is something called eccentric strengthening. This isn't your typical gym bro lifting. It's all about focusing on the part of the movement where the muscle is getting longer while it's still under tension. So think about slowly lowering a weight. It's this specific kind of load that tells your body, hey, we need to make new collagen here. Those are the building blocks of your tendon. And it helps line it all up in that strong, parallel bundle of string structure we talked about. But I have to give you a reality check here. This is not a quick fix. You are fundamentally changing the architecture of your own tissue. That takes time. You have to be patient, and you have to be consistent. The research is crystal clear on this.
You've got to stick with these exercises for at least 12 weeks to see real, durable, lasting change.
Of course, there are plenty of other treatments out there that you'll hear about, but it's so important to understand what they do, and maybe more importantly, what they don't do. Let's put them into perspective. Okay, let's just look at the options side by side because this really puts it all into perspective. You've got eccentric strengthening over here. Yeah, it's slow to start, no doubt, but look at that long-term healing. Excellent. The risk? Super low. Then you have things like topical anti-inflammatory creams. They can give you some fast, short-term pain relief, which is nice, but they do nothing for long-term healing. And then we get to corticosteroid injections. Sure, they can knock down the pain fast, but check out that long-term healing column. It says negative. That's right, they can actually get in the way of healing and make the tendon weaker over time. That's a huge trade-off. And let's be incredibly clear about this. This is a direct quote from the research. Use these injections with extreme caution. They are a short-term Band-Aid, not a long-term solution. By masking the pain and potentially making the tendon itself weaker, you could be setting yourself up for a much, much worse injury down the line. So, what does this all mean for you and your elbow? Let's boil it all down into a clear, simple blueprint for how you move forward from here. First, let's start with some fantastic news. The evidence is overwhelming that about 80% of people get completely better with just this kind of smart, conservative approach. Surgery is truly a last resort, and it's almost never needed if you follow the right plan. So let's hammer home the what not to do's. First, avoid just shutting it down completely. Putting your arm in a sling or forcing total rest just makes all the supporting muscles weaker, which actually puts more stress on the tendon when you do start using it again. You've got to keep moving in ways that don't cause pain. Second, please do not chase injections as if they're the cure. Think of them like a fire extinguisher for a moment of just unbearable pain. But they do absolutely nothing to rebuild the house to make it fireproof. The real work is in the strengthening. And finally, this brings us right back to where we started. You have to get out of that old inflammation mindset. If you're only focusing on anti-inflammatory pills or creams, you're just treating a symptom, not the root cause. The real problem is a weak, disorganized tendon that is begging to be rebuilt. You see, getting better from this isn't a passive thing you wait for. It's an active process. Your body has an incredible ability to heal itself, but it needs the right signals from you to do it. So the question to leave you with isn't just, how do I stop the pain, but what is the first small step I'm going to take today to start rebuilding my tendon strength? Thanks for tuning in.